So my father was actually a doctor. He was a radiologist. So I used to observe him in the office and reading films, and I found the human body fascinating and biology. And from there, it was the only career I could ever think of. I'm originally from Jamaica, and I wanted to do a research project that was relevant to the Jamaican population. So I decided to choose a research project that focused on prostate cancer. And in doing so, I learned a lot about how you can impact men, not just from, chemotherapy or other treatments, but also through surgery, early detection. As a urologic oncologist, most of my patients are referred by other urologists. So they actually will come either with a diagnosis or a suspected diagnosis of a urologic cancer. So when the patient comes for the first time, what I'll do is go through things like their images, explain to them kind of the anatomy and what they're seeing and why there's a suspicion of a urologic cancer. I'll talk to them about the different approaches to diagnosing urologic cancers, and then we'll delve a little bit into the treatment of the cancer. I try to make it as relatable as I can because a cancer diagnosis is very challenging. And then from there, we start to break it down to how can we tell for sure it's cancer, and if it is cancer, what do we do next? Trying to relate to the patient, show empathy, explain to them that with this diagnosis, it doesn't necessarily mean that all hope is lost. We're going to start off with, again, diagnosing, confirming it, giving treatment options, and after treatment, the understanding that you're always going to be under surveillance. I do try to reiterate that this is a long-term process, and it's something that I'm here to help with. I am trained in evidence-based medicine, and I believe in the rigors of science and sticking to the evidence. I'm always open-minded to an approach from them. If they think they want to try something new, I'll always listen. I think the most rewarding part of my job is being able to provide, comfort and reassurance to patients, knowing that they're not alone and knowing that there's somebody who's there to help.